Hi, Dr. Amy. Hey, they brought Tommy out for us today, but I think we just need to take him back because they want us to address the cribbing, but everybody knows cribbing is just a boredom issue.
No, it's not. Cribbing is more frequently an irritability issue. Most of these horses are displacing pain from other areas of the body. Right? Movement, motion, that endorphin release they get from cribbing quiets pain that's in the rest of their system. What we have to remember is that it's like phantom limb pain in people who have had amputated limbs. I don't know if you're familiar with that syndrome, but it's called phantom limb pain. People who have lost an arm or a leg will complain that they feel pain or tingling in the limb that's no longer there. What happens there, Dr. O, is that the sensory part of the brain that was feeling those fingers before has been taken over because it doesn't go away. The brain itself is still there, the sensory cortex is still there, and so another part of the body's sensory input moves in, sets up shop. So now some other part of the body is using that sensory cortex as its own home territory. Now they feel the pain and they want to get rid of it. Most of the time, these cribbing animals are trying to decrease pain that's coming from their GI tract. If we look closely at Tommy, we can see that he's not exactly a real good weight gain kind of guy. He's a little on the thin side. He has some difficulty gaining weight. That's been reported from the barn owners. And so what we need to do is take a look at some of those symptoms and address the underlying issue, the underlying problem of pain, which is more likely coming from his GI tract than from some limb or some other musculoskeletal area. But the cribbing actually helps them to get a little endorphin release that quiets the pain that they're getting from the actual inner intestine. So how could chiropractic help reduce this GI tract irritation and some of the other things that come from cribbing?
Well, there's a couple things. Because we have to remember, if we take a look at our inflammation cascade.
Pull up that poster. It's right there.
Cascade. It's a vicious cycle. And we just go around and around this cycle. And so anything we can do to stop that cycle. Because if we look at Tommy, not only does he have inflammation here, he has some pain here. When we ask him to move, he pins his ears immediately. He's not moving correctly in here. So we have inflammation here.
I think we need to remind our viewers, Dr. O, that pain is divergent. So you may have pain in your toe. Tommy may have inner pain in his GI tract, but it radiates. It doesn't become focused. It goes everywhere, and pretty soon he's not really sure where he's painful.
Right. So we have pain here, we have pain here, we have lack of mobility in his shoulders because we can see he has a saddle fit issue. So we have this issue here. And if we ask him to move his legs all the way forward, he hesitant right away. So let him down, get him to relax again, which is really hard to get him to relax because he is so painful. But if we pick up his foot, his ears pin, and if we ask him to bring it all the way forward, he's going to pull back. We know he's got some issues here. And then if we ask him to come up here and bend his neck, because of the cribbing collar, because of the mechanics of that, it's restricted his motion at the pull. And if I ask him to flex,
he looks a little upset.
He can't do it. I mean, he's trying to bite, back up, all kinds of things. So with chiropractic care, we can help restore joint motion.
That's been caused by the muscle spasm from using that jaw.
Inappropriately.
Yes.
So we can relax some of these muscles, some of these joints, get them more motion back in them. Not only that, a horse like Tommy is an excellent horse. We need to get him on some kind of anti-inflammatory, CetalM products. Sorno.
Should I remind you that even some of the Young Living products are made to help with these
The pain.
GI tract irritated animals.
Yes.
And it's a very, very nice way to get that pain out of their system.
Right, we can use the living oils, we can use them in the barn, we can use them in the water, we can apply them directly on him. We can put them on his saddle pad so that it helps when we are moving him, when we're riding him. We can use the standard process mobility support, which is going to help, the whole body move better. And basically, this is a horse that is cribbing. We see that as a vice, but we can't just slap a cribbing collar on him and say, okay, we're good to go. Because the pain and inflammation in his body, remember that chart I showed you earlier, that circle is a vicious circle and it just keeps building and building. Everything on the left is a healthy animal. Everything on the right is on
Pain
its
and
way to
inflammation and not feeling good. And it also depletes their immune system, makes them more likely to pick up other problems like respiratory illnesses, GI tract bacteria, things like that.
Yes. So a horse that has a vice like cribbing is an excellent horse that needs to be under care, that needs to make sure we address his inflammation issues. We need to alter his diet. We need to...
One of the things we note about Tommy is that he's not only red, but he's got a lot of white on him. And that particular color pattern is going to make him more susceptible to some of the environmental influences that are going to cause some of these things in the first place.
So we can take a horse that has a vice like Tommy, cribbing, that has some obvious incidences of pain. We can see those through some alternative therapies, chiropractic care, acupuncture, some change in his diet, add some supplementation, maybe some essential oil use in the barn, and hopefully we can take a horse like Tommy.
There's no hope to that. I'm certain that we will see some improvement because as we decrease the sensory input from aberrant neurology, we're going to improve his sensory input, which improves his motor output.
And harmonize his horse's health.